Assalamualaikum and hi. So today we will be presenting our group assignment which is on topic health issue in Malaysia. The first presenter will be me, Aisyah Syahira binti Sawal. The second presenter will be Nadia Akilah binti Ahmad Nazri. The third presenter will be Nur Farah Izzati binti Khairul Nizam. And the third presenter will be Muhammad Haris bin Azhar. The first topic that we will discuss is about coronavirus in Malaysia. The second topic will be mental health issue in Malaysia. The third topic is cancer issue in Malaysia. And the fourth topic is obesity issue in Malaysia. So let's get started. Coronavirus, Malaysia recognized as one of the most successful in handling COVID-19. In 2020, the history began where every country is struggling to fight coronavirus. Malaysia also faced the same situation where the cases become increased gradually. On 18 March 2020, government began MCO. After 7 months Malaysia struggling with the virus, Malaysia's success in controlling the spread of COVID-19. According to Dr. Nur Hisham, he said that in addition to increased capacity and the number of diagnostic laboratories, they increased the number of hospitals treating COVID-19 patients from 26 hospitals to 40 hospitals, including 7 which function as full COVID-19 hospitals. Despite the success that Malaysia gained, one of the reporters from Al Jazeera making false claims against Malaysia regarding the management and treatment of illegal immigrants with COVID-19. It was false claims because all the illegal immigrants were treated fairly and well. The government respects them as normal human beings by giving them 3 meals per day, toiletries, and extra dry food. None of them were mistreated, and when they discharged, they were given free new clothing. They also get COVID-19 screening tests for free, and all the charges are borne by Malaysian government. In a nutshell, Malaysia is one of the best countries for their healthcare, and it was recognized by WHO with a score 95 out of 100. The facility also were the best in Asia. In the future, I hope Malaysia will improve their healthcare system to be the best from the best and success in finding the vaccines for coronavirus. I am proud to be Malaysian.
So today we're going to talk about a mental health issue, which is a common thing that happened in Malaysia. What is mental health? Mental health includes our emotion, psychological and social well-being. It affects how we think, feel and act. It also helps determine how we can handle our stress and make the choice. Mental illness is the second biggest health problem in Malaysia after heart diseases. A psychiatrist and senior lecturer at University Putra Malaysia, Dr. Michael Ang, said that there are many forms of mental health issue, and the most severe one which is schizophrenia, major depressive disorder and bipolar disorder. According to the latest National Health and Mobility Survey, every 3 in 10 adults above 16 years old suffer from the mental health issue, which is about 29.2%. The prevalence of mental health problems among the adult increased from 10.7% in 1996 to 29.2% in 2015. The recent cases of mental health problem is about people keep losing their job and frontliner were having mentally and emotionally during pandemic COVID-19. The other cases that related to mental health, which is in May 2020, is about a daughter killed her own mother, and police found out that the woman who aged 53 years old having a mental health problem. Also have cases in the 5th July, which is caused by divorce problem and case among teenagers, who also suicide case in February that having a depression with the school problem. Lastly, mental health cases are dangerous and have to be controlled. If not, there will be bad for us. So if we have the symptom that related to their mental health problem, we have to seek for our help and do not keep it to ourselves. Thank you.
Today I will be sharing about cancer among women in Malaysia. Do you know that not only the number of new cancer cases has risen, but the percentage of cancer cases detected at late stages has also increased in Malaysia? The Malaysian National Cancer Registry (MNCR) reported a total of 115,238 new cancer cases from 2012 to 2016, 55.3% of which were among females. Breast cancer, colorectal, and cervical cancer remain the three most common cancers in women. In fact, just by being a woman predisposes you to both breast cancer and cervical cancer through other risk factors such as family medical history, age, race, and lifestyle choices. Mahkota Medical Center consultant oncologist Dr. Sham Weng Yun says smoking is a common risk factor for several types of cancer. Lack of exercise can also play a role in whether you are at risk of breast and colorectal cancer. For cervical cancer, having several sexual partners increases your chances of getting it. While risk factors are individualized, there are things you can do to lower the cancers, like making the right lifestyle choices. All in all, it is important to do cancer screening tests, especially if you have high risk factors like a family history. Women who are not being screened earlier or regularly enough to catch cancer at its early stages put them at risk for low survival rates. Besides, you must also watch your diet and exercise regularly to reduce the risk of catching this cancer. Thank you.
Obesity is not just a cosmetic concern, it is a medical problem that increases your risk of other disease and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. There are many reasons why some people have difficulty avoiding obesity. Usually, obesity results from a combination of inherited factors combined with the environment and personal diet and exercise choices. Everyone wants to enjoy their life to the fullest, but obesity can diminish your overall quality of life. You may not be able to do things that you used to do, such as participating in enjoyable activities. You may avoid public places. People with obesity may even encounter discrimination. Other weight-related issues that may affect your quality of life include depression, disability, sexual problems, shame and guilt, social isolation, lower work achievement. In a report issued in February 2020, WHO said obesity has reached epidemic proportions globally, with at least 2.8 million people dying each year as a result of being overweight or obese. I will share basic ways of how to avoid obesity. First, exercise regularly. It doesn't take too much time, but try to jog or do activity that you like. If you are lazy, then I can't help you. You are just discriminate yourself. And second, follow a healthy eating plan. Follow the guidance of food pyramid. Try to have variety of nutrients with suitable consumption to stay healthy. That's all from me. Thank you.